Hi, I'm Chris Christenbury, and I'm here with Dr. Andrew Shaw. And today, Dr. Shaw, I'd like to spend a little time talking about this thing that you call mindfulness. I hear you talk about it a lot, and it's very interesting.
Yes. We have a radio show together, and we often talk about that, right?
We do.
Right.
And I guess the way to start out is just give a brief description of what mindfulness is before we really expand it and unpack it.
Okay. Well, I think the simplest way to explain mindfulness is consciousness has a variety of aspects to it. Mindfulness is that part of our consciousness that stands back and observes, and so it's awareness of what arises in the moment. So I just heard a car go by. A bus, thank you. So as we were talking, my brain was engaged in the conversation, but at the same time I was still aware that something else arose in the moment. So mindfulness, quite simply, is this very healthy aspect of consciousness that observes and is present in the moment. And that's, I guess, the best way to describe it. You can hear people talk about this on the internet quite a bit. I mean, mindfulness is really making waves in psychotherapy these days. I've been practicing meditation and strengthening mindfulness for over 12 years, so it's really nice to hear some of these concepts enter the mainstream. But it can sound maybe mystical or mysterious, but it's really not. But just because it's a simple concept, don't be fooled to think that it's easy. Most of us in our development have not been trained in mindfulness. As a matter of fact, we listened to a good talk by a colleague, Dan Siegel, who talked about the fact that he feels that there should be a fourth R in the school system.
Absolutely.
Not reading, writing, arithmetic, and reflection, because we don't train our children very well in this this concept of mindfulness. If you're lucky and you have very mindful, very aware parents, they train you in mindfulness, but they don't name it. So if you're one of the lucky people that have had really good parents, you probably have a high degree of mindfulness already, but many people in the world don't. And I guess we'll talk about why that's so important.
Why is it so important?
Why is it so important? Well, thank you for asking. It's important. I would say that it is the factor in our awareness that allows different parts of the brain to begin to communicate with each other. And that's really very important, because oftentimes what happens is when we're emotionally triggered, Daniel Goleman calls it an emotional hijacking. He wrote a very beautiful book called The Emotional Intelligence, and what he says in that book is when you're emotionally hijacked, when you're triggered by something emotionally, you literally can't think. Okay? Now, people that have a high degree of mindfulness can think, but most people can't, because that surge of adrenaline and that powerful emotion takes the frontal lobes kind of offline, and it's hard to think. And so a lot of times we've grown up reacting to our emotions and just kind of haphazardly saying or doing things that lead to poor outcomes. Well, where mindfulness can help you is if you can be aware of that emotion as it begins to arise, you can consciously choose to then engage the frontal lobes and begin to start to process that emotion and make decisions about what you're going to do, as opposed to just react.
So the frontal lobe is the area of executive function.
Yes. It's the area of the most advanced part of our brain that is involved in organizing, planning, thinking,
cautioning,
pausing.
Right.
Absolutely.
And it's important for that part of our brain to be heard.
Yes.
But it's just as important for that limbic brain to be heard too, because
Absolutely.
the limbic brain can get us out of trouble.
Yes.
Of course, it can get us into trouble too.
Exactly. But that, that limbic brain sometimes is way ahead of the frontal cortexes. Like probably many of our audience may have had the experience of walking in an area of town that's not quite comfortable, and that emotion that starts to arise is there to protect you. So to stay aware, to be alert. So the limbic system isn't the bad guy in this story. What we're talking about is, but when different aspects of the brain are communicating, you can make decisions on what you do with your emotions. And, I believe that as we are evolving, Daniel Goleman's book eventually may be outdated. And what I mean by that is, as we evolve into beings that are much more comfortable and aware with our emotions, we will be able to feel intensely and think well at the same time, which will be a huge, I think, advance. The reason mindfulness is such an important part of psychotherapy is because it's that component that observes and watches and then allows us to make choice. And actually psychotherapy in itself enhances that process. I'll give you an example. Often in therapy, I think I talked about this in our first video, I'll see a patient begin to have a powerful emotion. And often because of earlier unsatisfying experiences, I'll see people try to quickly move away from that. Well, because again, I've been trained in mindfulness and am very aware and comfortable with emotion, I often am bringing the patient back towards their emotion. So I'll often say, for instance, Chris, I noticed that you look like that really upset you. Let's pause there and let's try to understand what you're feeling. That may sound simple, but when we bring a patient back again and again to an emotion and they sit with it and they become more mindfully aware of it and comfortable, two things happen. They become more comfortable. So that's a big advance. They don't have to continue to flee from their emotions. The second thing that happens is as you get more comfortable with your emotions and you begin to be able to sit with them, you can then engage the frontal lobes even more, and you can become that detective and really start to kind of examine the emotion. We can examine what triggered it. Why did that particular trigger create the emotion? What emotions did you have based on that trigger? What were your assumptions about what would happen next? Or let's say it was an interpersonal situation where somebody sparked a lot of anger. We might examine what are your assumptions about what their intention was. All of those areas can be explored with the frontal lobes, and then the beauty of that is patients start to see that they have patterns in their assumptions, and when they start to see that there's patterns, they also then start to see that may not be the case. They start to see that a lot of the more core assumptions that they make are based on their early experiences, and they tend to bring them forward and overlay them on the present. And one of my favorite sayings is, just because the only tool in your toolbox is a hammer doesn't mean that every problem is a nail. So you can imagine if you got the same tools and you keep using them over and over again in very different situations, there's going to be many situations where you have a very poor outcome. So what psychotherapy does is to kind of help you to catch yourself, see the emotions, see the assumptions, see your patterns, and then you stop and you say, wait a minute, looks like I might need a hammer. But no, wait a minute, if I look at it a little closer, I think I need my saw. And to be able to reach in and use different tools and to use them at the appropriate situation is highly adaptive, right? Imagine if you
Yeah.
only had a hammer to build a house, it
Yeah.
probably wouldn't look
Well,
too.
I remember when I was a police officer in the police academy, we spent a week learning emergency driving. And one day in the classroom, they taught us all about skids and how to go into a skid, get out of a skid, recover from a skid, stop a skid, you name it. We knew everything there was about skids.
Right.
We knew it in our brain.
Yeah.
Well, the next day, they gave us all helmets, and they took us out on the skid pan, which was a huge flat area that they poured oil on. And we found out we didn't know anything about skids.
I love that. Knowing and knowing
Yeah.
are different things, and gently experiencing your emotion is one thing, deeply investigating it and knowing
Exactly.
it is a totally another thing. And the thing about therapy is you have to, the experience of the emotion and really experiencing it in the therapy room and processing it and dealing with it, that's like when you were out on, what you call it?
The skid pan.
The skid pan, yeah.
Because at the end of the day, I was very adept at dealing with skids.
Yeah.
So after psychotherapy, you learn appropriate ways to deal with emotional skids, and then when they come up, you just steer into the skid.
Yeah.
You don't steer away from it.
Absolutely.
You don't go nuts. You just
As
handle it.
one of my patients once said, I love this term. We had been in therapy for about a year, and he had brought in what we call relationship episodes, where he really talked about relationships, and we investigated them, and we talk about them in retrospect. And one day he looked at me and he said, he looked at me in this shocked way, and he said, Dr. Shaw, he said, I just understood, I just had an insight about what psychotherapy is about. And he said, it's like we come in here and we examine things and we look at them and investigate them so that I'll be prepared to deal with them in real time. So what he became aware of is, if we just talked about some things in a therapy room, like, you learned about skids in the textbooks,
thought we knew it all.
it would be pretty useless. But the therapy room is more like an experiential laboratory where you're actually learning to manage and deal with emotions and begin to practice how to talk about emotions and to express yourself with another human being. Wonderful book I read about mindfulness and meditation. The author compares it to, imagine if you come into your kitchen every day, but the light is not on, and you keep stubbing your toe because you can't see. If you all of a sudden turned on the light of mindfulness, or turned on the light, so to speak, you would just simply stop stubbing your toe.
I don't want to get into Kabbalah because we're talking about mindfulness, but Kabbalah would tell you.
And why don't you explain for our viewers a little bit about
Kabbalah is mystical Judaism. It goes a little bit beyond what you read in the Bible. It goes a lot beyond. But Kabbalah would say that thing that you've stubbed your toe on in the dark, when you turn the light on, it may be a very valuable thing. And you've cursed it all these years because it hurt you.
Yes.
But it's really something very valuable, and you didn't know it.
Right.
Because you couldn't see, because you weren't mindful.
Exactly.
You weren't seeing what it was, you were only seeing the pain that it caused you because something happened way, way back.
Exactly. And that's a wonderful, I think maybe we'll end on that, but that's a wonderful way to think about psychotherapy in general, because as we talked about, I think in the first video, the difficulty of psychotherapy is that, you do have to face painful emotions that maybe you've stored and tucked away for years. So to understand that sometimes, what we think, we label pain as bad, but pain has something to tell us. So if we can understand that therapy at times is painful, but boy, the benefits of what we learn from that pain is so invaluable.
Yeah.
I think that's a healthy way to look at psychotherapy, and you won't have too much of a short-sighted view on really what it's about.
Great. Dr. Shaw, thank you. I look forward to our next video.
Well, thank you for having me, and I really enjoyed talking with you. All right, I'll see y'all later.